Hi, how are you? I'm Ashika. I'm going to be your PA today. How are you doing?
I'm okay.
Okay, so I'm just going to look at your chart right here. So can I just confirm your name and date of birth?
My name is Julia Francescus, and my date of birth is May 5th, 1960.
Okay. So what brings you in today?
So my eye is like really hurting me a lot.
Okay. Where exactly on your eye?
So it's my right eye. I don't know, it's just like inside my eye. It just hurts.
Okay. Well, I'm sorry that, you're dealing with that. So how long has your eye been hurting?
I would say for like just 4 days now.
4 days, okay. And what made you come in today rather than coming in before?
I don't know, I just thought it might go away. I've never really had this before. And I mean, it didn't. I was just super busy.
No,
and so then
completely understand. Let me see the rest of your chart here. So you said it started 4 days ago, and then 4 days ago when it started, was there anything specific that you think might have triggered your eye to start hurting? Were you doing anything? Did you do anything differently than you normally do in terms of, taking care of your eye and like washing your eyes and things like that?
no, I just woke up in the morning and I had this eye pain, and so it was just so sudden. I don't know like where it could have came from.
Okay. And then, so you said it was more of like a sudden like onset when you just woke up, like it was just kind of there. Okay. And then, is there anything that makes your eye, worse or better in any way? Have you taken anything? Have you done anything?
I haven't taken anything. I've had these headaches with it, so I've been taking Advil to try and help with that. But other than that, I haven't really taken anything. I didn't want to just try any drops. Just in case.
Right, definitely. No, I'm glad you came and, wanted to get it checked out. So, we can definitely help you with that. Let's see. So has the pain gotten any worse since when it first started, or is it just kind of the same?
Yeah, I would say it definitely got worse.
Definitely got worse. Okay. So when your pain first started 4 days ago, how would you have rated the pain on a scale of 1 to 10, with 10 being, the worst pain you've ever possibly experienced?
Okay, I would say maybe like a 4.
A 4.
And then now, it's probably like a 7.
A 7. Okay. So that's a pretty drastic change in 4 days. And have you experienced anything like this before?
No, I've never had this before.
No, never had anything like this before. Okay. Okay. And the pain itself, is there any way that you could describe the pain? Is it like a dull and aching pain? Is it kind of like sharp? If you could just describe it a little bit for me. If not, that's okay.
I would say it's probably like a achy type of pain
Like
inside my eye.
Okay. Let's see.
It's just like really irritating, and it doesn't feel like anything in my eye. It just feels like there's something wrong with it. It just hurts really bad.
No, I'm really sorry to hear that. And the pain itself, has it just been kind of localized in that one area, part of your eye that you said? So you're saying you're pointing to like your upper lid. Do you mind pointing to where the pain is with one finger on your eye?
Yeah. I would say it's just in the middle, in the inside of my eye.
The middle inside of your eye.
Mm-hmm.
Okay. And has the pain like changed location at all? Like, was it anywhere else before?
I don't think so.
Just kind of
just
there.
Kind of just in my eye.
Okay. And you did say that the pain was just there in the morning. So has that kind of consistently been the same thing? So when you wake up, is the pain worse? Does it get worse during the day? Is it a little better during the day?
I think it kind of just stays consistent, but I've just noticed that since I first noticed it, it just gets gradually worse.
Okay. So it gets gradually worse as you progress throughout the day.
Uh-huh.
Okay. And so you said that you do get headaches with this pain, right? So how long have you been getting the headaches since you first started getting this pain 4 days ago, or are the headaches kind of like separate? Like, do they come on and off?
I don't really get headaches, but once I had this pain, I started getting severe head pain.
Okay.
So it's not really usual for me to get it, so I didn't know if it was related or anything like that.
Okay. That's definitely good to note. In terms of the headache, do you think you could point with one finger kind of as to like where you would feel the pain? Is it like the back of your head? Is it like more towards like your temples?
It's just like, yeah.
Just like temples?
Uh-huh.
Okay. And so the headaches started, like you said, when the pain started. So do you have a headache right now?
Not right now, but I did earlier today.
You did earlier in the morning.
And I usually do. It's like kind of there all the time, but sometimes it feels worse.
Okay. So you did have a headache this morning. Okay. Sorry, I just had to check something on my phone. Pager goes off really often. So I just want to ask a little more about your headache, if that's okay. So you said you've been taking Advil to make your headache better. Is there anything else that you've done, maybe like a warm compress or anything like that has helped your headaches at all, or no, just the Advil?
I've tried some warm compresses, and that kind of helps a little bit.
Okay.
But it's just like no matter what I do, it's always kind of there, you know? Even with Advil, it's just still there. So it's just, it helps a little bit, but there's just, I don't know, I just feel like something's going on. It's not normal.
Yeah, no, definitely. That is definitely not something that you want to be experiencing. And then the headache itself, how would you rate, like, I guess, like, the severity of your headache, on that 1 to 10, 10 being, the worst headache that you've ever had?
I would say, like, this morning, it was probably an 8.
Oh, wow.
It was really bad. And I think it's just, gotten worse with my eye pain. Like when I got it, the eye pain, I had the headache too, but it was probably like a 4, or 5, but now it's like an 8. It's bad.
Okay, no, I completely understand. And has the headache just always stayed in that temple area, or has it moved at all, or no? It's just mostly in that area.
Yeah.
Okay. This is all really important information. And then, in terms of medications, are you taking any medications right now?
Yeah, I'm taking diuretics.
Okay.
For hypertension.
Oh, okay. Do you know which diuretic you're taking and what your dosage is?
I don't know offhand, but
okay, that's fine. I can find that information out later on, so that's completely fine. But that's important for me to know. Any other medications or anything? Any contraceptive pills or anything like that?
No.
No? Okay.
I'm married, so.
Oh, okay. Okay. And then, do you have any known drug allergies, allergies to any insects or animals or any foods or anything like that, or even sensitivities to anything?
Nope, nothing else.
Okay. Okay. Let me just look at this and see if there's anything else that I wanted to ask you. Okay. So, I'm just going to ask you a couple of questions just in terms of your past medical history. So is that okay with you?
Yeah.
So in terms of your childhood, have you experienced any childhood illnesses like chicken pox or, measles, mumps, scarlet fever, anything like that?
Oh, I got
No? Okay. Let's see here. Did you ever get the flu?
The flu? Probably, yeah. I probably got it a few times.
Okay.
Not recently, though.
Not recently. And do you typically get like the flu shot?
I usually do.
Okay.
Mm-hmm. More recently, I've started to get it, and I haven't like gotten the flu, so that's good.
Okay, that's good. And I apologize for not asking this earlier, but what is your occupation? Where do you work?
I'm a teacher.
You're a teacher. Okay.
I teach the 6th grade.
That's awesome. That's really great. Seems like a very rewarding job.
Yeah, I love it. Love kids.
And then in terms of any other medical conditions, so you said that you do have hypertension. Is there anything else, any other medical conditions that I should be aware of besides hypertension?
Well, I got my eye examination like a year ago, and they told me that I had like very severe nearsightedness.
Okay.
I don't know if that's even an illness or anything, but
it's not an illness. It just means, so do you wear like glasses or contacts?
I usually do.
Okay, so nearsightedness, basically it just means that you're having trouble seeing things far away.
Mm-hmm.
So I see that you are wearing your contacts right now. So that's just basically your contacts help correct that. So how long have you been wearing your contacts for? How long have you had glasses or contacts?
For years, like probably like 20 years or something. But
20 years,
the doctor just said that my nearsightedness is, I guess, like pretty bad compared to other people's, and it's like very severe. So he said that he would watch it or something. But
so you said that you went to the eye doctor 1 year ago, right? So would it be like 1 year from like now, or like?
No, probably like from now, maybe like 6 months ago, 7 months ago.
Okay. And so from that appointment, so is there anything else that your eye doctor said, or is that that he's monitoring for that I should be aware of? Anything that you can remember, maybe?
I'm trying to think. I mean, I think he was just worried because I have hypertension that I don't know, that can affect my eye somehow, or I don't know. Maybe
that's okay. I can definitely make sure that I get that information from your eye doctor, but really glad you mentioned that. That's really important. And so I would definitely recommend that, because your eye doctor said that you do have, severe nearsightedness, that, maybe you make an appointment instead of every year, maybe every 6 months. So go twice a year just to, monitor your condition a little more closely, just to make sure, in case your, eyes do get worse, that you get your, contacts, your prescription changed immediately, because that can affect your driving, working as a teacher, just your daily life in general, just to make sure that you have, the best vision possible. So that's definitely important. So do you have did you have any accidents or injuries throughout your life? Any like car accidents or any broken bones or anything like that?
I broke a finger.
You broke a finger?
Yeah.
Okay. And when did that happen?
I broke my thumb like a long time ago in high school, so that was like 30 years ago.
Oh, wow.
But that's the only bone I've broken, so.
And how did that happen?
I was playing, sports, volleyball.
I used to play tennis in high school, actually. I loved
really?
it. Yeah.
Wow.
That's really great. Yeah, sports are awesome. And then have you never been in a car accident or anything like that? Okay. And so for your broken thumb, I believe that you did go to the hospital and get it, treated. So do you know what exactly they did? Do you know what hospital you went to?
Yeah, they just put a brace on it. I went to Stony Brook Hospital.
Okay.
Which is pretty close to my house. They just braced it, and I probably had the brace on it for like maybe a month or two.
Okay.
And then they took it off.
Okay. And you haven't had any issues with your thumb after that?
No.
Okay.
You're good.
Okay. So do you have any other hospitalizations besides that one?
No. I don't really get sick that much. That's good.
Okay. That is good. Nobody likes the hospital.
I know.
Okay. So if you assume that since you haven't had any other hospital visits, you haven't had any surgeries, have you had any wisdom teeth removed?
Yeah, I have had wisdom teeth
Okay.
removed. When I was, I think, 20, I had my wisdom teeth removed. I had all 4 out.
Okay.
But that was, I think, the only surgery I've ever had, honestly.
And then in terms of taking care of yourself and your health, so you said that you do go to the eye doctor, which is very important. And you said you normally do get the flu shot as well.
Mm-hmm.
Are the rest of your vaccines up to date for measles and mumps and all that?
I'm pretty sure I had a lot when I was younger, and then I had, HPV shot, vaccine, all of that when I was younger.
Okay.
I should be, pretty up to date, I would imagine. But
Okay. And when was your most recent blood test done, if you remember?
Probably not for, I'm not sure, maybe 2 years.
2 years, okay. So I definitely want to send you for a blood test,
Okay.
just to make sure, everything is okay. And maybe, I don't believe there's a connection with your eye, but just to make sure, we don't need to monitor for any other conditions.
Okay.
That's just really important. A blood test can tell us a lot, so that's definitely important to get. And then, because you are a female, do you typically get your period? Is it normal?
Mm-hmm. Yeah, I get it once a month.
Once a month, okay.
I feel like I'm probably going through menopause. I don't
Okay,
get it that frequently.
Okay.
I'm not through it yet. I'm kind of late bloomer, I guess. But I don't know. I feel like all my friends got it too around my age. So I feel like I'm starting to go through that cycle.
Okay. So when did you first get your period? Do you remember?
Yeah. I got it when I was 15, so pretty late.
Okay.
So maybe that's why I haven't gone through it yet.
That's completely okay. Everyone's body's different. So you were 15, and then you said that your flow is normal right now, but you're moving towards menopause, which is normal at your age. And let's see here. So when was your last period?
My last period, it was a month and a half ago.
Okay. So yeah, the frequency is definitely changing.
Changed.
That is normal. And then, do you regularly see a gynecologist?
Yeah, I've seen one a year ago from today.
Okay, that's good.
And they said everything was fine. I had pap smear.
Okay, that was my next question. And pap smear and everything was normal. Okay. And do you have so? Let's see here. So, have you are you pregnant, or have you ever been pregnant?
I have 3 kids, so I was pregnant in my 30s.
Okay.
Wow.
And so for your birth, so you have 3 kids, and so did you have any complications with any of your children? So were they all normal births? Were any of them C-sections?
Yeah, I had 2 C-sections. My first was a normal birth.
Okay. And then 1 normal birth. Okay. Okay, that's good. And are you currently sexually active, with men, women, or both?
Yeah, just with my husband.
Just with your husband. Okay. I'm sorry, I have to ask that.
No,
to all
yeah,
my
that's a good
patients.
question. It's 2017, so
Yes, that is true.
it's new generation, yeah.
And do you use any sort of protection against, sexually transmitted diseases, things like that?
Well, I got my tubes tied, so
Okay.
we don't really use protection, and I'm just having sex with him, and I'm pretty positive he's only having sex with me, so.
Okay. I know that you guys have been married. How long have you guys been married? It's probably been a long time.
It's been a while. It's been 32 years.
32 years. Okay. So I know sometimes this is, a difficult question to ask, but sometimes it's, it's definitely a good thing just for both of you guys to get tested. Maybe once a year or so. I totally understand that, you and your husband, do not have any other partners, but just to make sure for both of you guys, for your sexual health, it's really important.
Okay.
So I do recommend that to all couples. And then moving into more of your family history, so in terms of any major, whether it's mental illnesses or medical conditions, are there any conditions that kind of run in your family that, so, your parents, do they have any conditions, and how old are they?
So my mom is like 81, I think now.
Okay.
She has diabetes,
Okay.
and she also has hypertension.
Okay.
My dad is pretty healthy. He's 82. Doesn't really have any problems, so that's good.
Okay, that is good. And then, do your grandparents, or did they, are they, here right now, or did they pass away?
They both passed away on both sides.
Both sides, okay. And did they have any medical conditions, and how old were they when they passed away?
So my grandpa on my mom's side was 75, so he passed away a while ago, and I think he had diabetes too.
Okay.
I think he kind of like ran in the family on her side, and I know her mom had hypertension.
Okay. So yeah, diabetes and hypertension seem to be very pertinent in your family.
And she was like 80. She just turned 80 when she passed away.
Okay. And then what about your paternal grandparents?
On my dad's side, they were pretty healthy. They lived till, my dad's mom lived till like 89. I think she just died of old age, honestly. And his dad lived until 91.
Okay. Wow.
And I'm pretty sure he was healthy. I don't really think anything is wrong with him.
Okay. No, that's definitely really good information to know. Have you been screened for diabetes specifically with your past, with your family history of diabetes? You have?
Yeah, I was screened pretty recently,
Okay.
and they said that I was okay.
You were okay.
But
Okay.
of course, like I think they want to watch because we have hypertension, like
Right.
so.
No, definitely. So those that's definitely a risk factor for diabetes. So I just wanted to make sure that you were being screened for that. Okay. And just some other conditions that I just wanted to ask about. So, do you have any family history of heart disease, tuberculosis, like any lung conditions or anything like that?
I don't think so.
No. Okay. And any cancer history?
I don't think so. No.
No. Okay. And then I just also wanted to ask, do you have any siblings?
I have one sibling,
One
one brother.
One brother. Okay. And how old is he? And does he have any medical conditions that you know of?
He's 54, so he's like 2 years younger than me.
Okay.
And I mean, last time I talked to him, he sounds pretty healthy.
Okay.
I know he doesn't have hypertension or anything that I have.
He does not. Okay.
So he's the healthy one in the family.
Okay, that's good. Okay. So I'm just gonna ask you some social history questions now. If that's okay.
Yeah.
So where were you born?
In New York.
In New York. Okay. Where in New York?
Manhattan.
Oh, very nice. I love the city.
I know. I love it.
So what is your highest level of education?
I went to college. I got a master's degree.
Okay.
I went to NYU in the city.
Okay. So you did say that you were a teacher. Is there any other environmental factors that I should be aware of that you're kind of exposed to?
Not really. I mean, I live in a city, but other than that, I don't really do that much. I do yoga and stuff like that, so
Yoga is really good.
I love yoga. But no, I don't think so.
Okay. In terms of your living environment, do you live in a house? Do you live in an apartment?
We live in an apartment.
An apartment?
Yeah.
Okay.